Expiratory muscle strength training, or EMST, is a rehabilitative technique, meaning it rehabilitates the physiology of swallowing. EMST utilizes the strength training principles of intensity and frequency. EMST is an indirect treatment, meaning that food is not used during treatment. EMST has been researched on various populations, including individuals with Parkinson's disease, Huntington's disease, multiple sclerosis, chronic obstructive pulmonary disease, elderly patients, and stroke patients who have deficits in the oral and/or pharyngeal phase of swallowing.
Performance of EMST produces greater expiratory pressure, which is generated and transferred through the upper airway into the EMST device, recruiting activation of the suprahyoid muscles. Suprahyoid muscle activation initiates the pharyngeal swallow reflex and also pulls the hyolaryngeal complex forward to assist in airway protection and help facilitate opening of the upper esophageal sphincter. It also helps strengthen the cough reflex, which has implications for expiration of foreign substances and thus airway protection. Adjust the spring for proper tension depending on your maximum expiratory strength. The goal is to adjust the spring to 60 to 80% of the maximum expiratory strength. Turn the blue knob on the EMST device as needed according to maximum expiratory strength. Adjustments can be made by turning the blue knob 1/4 of a turn clockwise to increase resistance or 1/4 of a turn counterclockwise to decrease resistance. Once you find your maximum expiratory strength, plug your nose and make sure your mouthpiece is secured and that you have a firm seal, meaning no air is escaping through the sides of your mouth. Take a deep breath and exhale when the mouthpiece is firmly behind your teeth. Blow hard and fast through the device. It is common to take a 1 to 5 minute break between trials to give respiratory muscles a rest. It's usually recommended that the patient completes 5 sets of EMST exercises 5 days a week for 5 weeks.
Park and colleagues performed a study with 27 stroke patients and randomly assigned them to one of two groups. One group who used the EMST device for 4 weeks, and one group serving as the control. Surface electromyography was utilized to measure suprahyoid muscle activation before and after treatment. Furthermore, the penetration/aspiration scale was utilized to assess results of video fluoroscopy, and the functional oral intake scale was used to measure dietary changes. Park and colleagues found that EMST improved suprahyoid muscle activation, thus aiding in upper esophageal sphincter opening and overall airway protection. They also found that penetration/aspiration scale results and functional oral intake scale results were improved after treatment. Limitations of this study included small sample size, and because participants were in the subacute stage of recovery, it is difficult to distinguish between the results of improved swallowing function from EMST's treatment and spontaneous recovery.
Park et al. Performed a single-blind randomized controlled study to evaluate the effect of EMST training on 24 elderly community adults with presbyopia or an aging swallow. The experimental group trained at the 70% threshold value of the maximum expiratory pressure using an EMST device 5 days a week for 4 weeks. They performed 5 sets of 5 breaths per day through the device for 25 breaths a day. 1-minute breaks were provided between sets. The control group received the same dosage using a sham EMST device that required no resistance. Researchers assessed oral facial muscle strength before and after treatment using the Iowa Oral Performance Instrument, specifically looking at the strength of the buccinator and orbicularis oris muscles. They also assessed suprahyoid muscle activation before and after treatment using surface electromyography, and they also looked at maximal expiratory pressure before and after intervention. Results indicated that EMST significantly improved both orofacial muscle strength and suprahyoid muscle activation in elderly patients who received training, whereas only orbicularis oris muscle strength was improved in the control group using the sham device. Therefore, this study found that EMST has a positive effect on muscle strength for swallowing in elderly individuals with presbyopia. Limitations of this study included a small sample size and utilization of subjects who did not have a clinically significant swallowing disorder.